Well, good afternoon. I'm Andy Eads. I'm Denton County Judge, and I would like to welcome some of our other speakers here today. I'd like to introduce Mayor Chris Watts. Mayor Watts is with us again. Thank you, Mayor. We have our Director of Denton County Public Health Department, Dr. Matt Richardson, and our Chief of Emergency Services Department, Chief Jody Gonzalez. I'd like to give everyone an update on our COVID-19 situation here currently in Denton County. Sadly, today we are reporting a total of 137 COVID-19 cases in Denton County. You'll notice from our chart here to my side that this is an increase today of 54 new cases over yesterday. So yesterday we had 83, we added our 54, we have a total of 137 cases in Denton County. What's notable of this is that of these new cases, these 54 cases, we have 31 new infections from the state-supported living center here in Denton. And there is one case which is from those are all from the patients and the residents there at the living center. One case is from a staff member which lives outside the county, and so that is not reported in our totals because those caseloads are determined by the home origin of the patient. So we have one that is outside. I would like to compliment our partners at the state of Texas and especially our local delegation, Senator Jane Nelson, Representative Lynn Stuckey, Representative Tan Parker have been in the trenches working with us here at Denton County and the city of Denton to add additional resources at the SSLC, and the mayor will go into some greater detail about that. Of these new community spread cases, 23 of those are community spread, and it adds 4 new municipalities to our list of growing cities across Denton County that have active cases of COVID-19. And those 4 new communities are Argyle, Corinth, Roanoke, and Crum. So this disease and its spread is not strictly to our urbanized areas, but it actually is spreading countywide, and I think that is of note. This morning, I'll give you an update that the Commissioner's Court did have an emergency meeting, and we did ratify the executive order I executed a couple days ago that was amended in a couple of ways. One was that it extended that executive order through midnight next Tuesday of March 31st. It extends it at least through then. The Commissioner's Court will be taking this item up again next Tuesday as well, and we will be looking at our caseload and the trends not only here in Denton County but in the Metroplex to see if we do need to extend this declaration longer than next Tuesday. But I made a commitment to the public that we were going to take this in weekly increments or shorter increments, but we were not going to be looking at longer increments than a week, and so we will be taking this up again next Tuesday in Commissioner's Court. I would like to just notify everybody that we have been meeting in this courtroom since 1896, and today was our first meeting really where we did not do that. We used a new technology. We had a Zoom meeting, and it was a new technology. There were some technical difficulties, I understand, early on in the meeting, and I appreciate your patience with us as we get through all these different trying times as we're looking at new technologies as we communicate with the public. Transparency is obviously something that we value. Not only is it mandated in the local government code, but it's something that we all personally embrace, and so any kind of public meeting that we have, we do want to be as transparent as possible. I do want to apologize. There were some technical difficulties early on. In regards to the order that we did ratify this morning with a unanimous vote of the Commissioner's Court, we did make a few modifications. Obviously, I mentioned we did extend it through next Tuesday night at midnight. We did clarify the language that our car dealerships can continue to operate with online sales and pickup and delivery, but the showrooms are closed. We believe that we are trying our very best to constrain the growth of this disease in the county, and so dealer showrooms are closed, and we believe that is the best practice. We also clarified our language on golf courses, and the golf courses are closed here in the county as well. We We do not deem a golf course at this time to be an essential function of the county, and we appreciate everyone's desire to get out and stretch their legs and exercise. But that does require staffing, dealing with golf carts and beverages and so forth. And so while individual golfers may be able to apply best practices of social distancing, we are requiring staff members to come in and work during those times and in those operations. So we're trying to live a good example, which we're asking everyone to do, which is to stay at home. Stay at home. We are encouraging everyone to stay at home during this time. The quicker that Denton County voluntarily stays home, voluntarily practices social distancing. What does social distancing mean if you're turning in for the first time? Let me explain it. Even when you're going to the grocery store or to the doctor or to the bank, apply social distancing. The sign interpreter and I are not applying proper social distancing probably right now because we're within 6 feet of each other, but we need to get in the shot. So it is important that we apply 6 feet of social distancing, and I am encouraging people to have boldness about that. Your life and your safety and that of your loved ones and friends and family is important, and that is why we need social distancing. So be an advocate when you're out in public and demonstrate and be an example to others of what good social distancing is all about. At this time, I'd like to introduce Mayor Chris Watts, and I know he has some comments and special news about the Denton State Supported Living Center, and he would like to talk about that and our good efforts that we've been making with our state partners. Mayor Watts.
Thank you, Judge. Well, first of all, I really appreciate, Judge, your leadership as we sent the joint letter to the governor. But most of all, I also want to thank the officials with the state of Texas because they moved mountains in helping the residents out at the State Supported Living Center. And I just want to go over briefly some of those, that plan that they put in place with the Health and Human Services Commission. The first is they're going to station 4 EMT units out at the Living Center for those that need transportation to the hospital. Additionally, they have developed a plan where they will transport those patients to hospitals throughout the county where they're able to see what the bed availability is and what's the most efficient way to meet the care and needs of those residents, thus also providing relief for the Denton hospitals. As important, they're going to provide on-site care for those individuals who do not need to necessarily be transported. They've set aside specific facilities for those who've been tested positive and for those who need care other than transport to the hospital, and will provide that care on site. And I just can't say enough for our legislative delegation, Senator Nelson, Representatives Tam Parker and Lynn Stuckey. We've been on many telephone conversations with them, and everybody's worked so diligently to make sure that the residents out at that living center have the best medical care that they can given their unique needs. And again, I just want to say one more time, because I think it's important. Judge, your leadership in this and your tireless effort and your tenacity I think has been one of the major reasons why we are standing here. And I appreciate the partnership that you have with the City of Denton in helping us really meet the needs of the residents out there in the community in a way that is just unprecedented in this state. So thank you very much.
Well, as I said the other day, this has been a team effort to identify resources, identify best practices plan, and be nimble in how we implement that and how we change that, and look really at the caseload that could potentially be out there, and how do we flex our resources here locally and across the region to do that. And from the governor personally calling me and expressing his deep level of commitment to this, our phone calls with the Executive Commissioner of Health and Human Services, Phil Wilson, all the way down through the administrative staff here on the local level and to our delegation, they have all shared our concern, which is that this most vulnerable population in Denton County receive the protection and the care that they rightfully deserve. So at this time, we'll be happy to take any questions.
Judge, local leaders pleaded for the state to provide a temporary field hospital. That appears not to be happening. What did the state tell you, sir, as to the reason behind declining that request?
Okay, so the question is, the state is not building an actual structure, a temporary structure on the facility, and are we satisfied with that? So I believe that the answer to that is that we actually developed what we believe in a combined effort is a better model than actually having a field hospital or a separate satellite facility there, by containing some and reallocating some of the resources there on site with the different individuals and providing additional resources there and moving these individuals here to other area hospitals. We believe that we have the capacity at this time to address that, and we don't need to have an actual facility there at this time. So I think this is actually, it accomplishes exactly what we were asking for. It's just a different model. Yes, ma'am.
So there's a total of 31 infections out of the state board.
Correct.
How many?
39. 31 new, total of 39. Yeah, so the question is, what is the total cases out there? So it was 8 yesterday, 31 new for a total of 39, yes.
And so have all the test results come back yet?
So we had about 10 results out, I believe we had. I'll have Dr. Richardson address that. Good question.
So we don't have all of the results in yet. I don't have the exact number. We are reporting positives. Negatives are not something we report, so we are tracking those. We have almost all, I can say almost all, but I don't have all of the outstanding tests. I don't have that information in front of me.
How concerned are you all that the number might grow beyond that 39?
I think there's a great concern. It's a pandemic. So in a pandemic situation, we know that community spread and in a spread in a vulnerable population is more than possible. We've given guidelines that are directed by the CDC to the State Supported Living Center. We've made those recommendations in an advisory role, and they've implemented those to our knowledge. And as far as we can tell, we believe that's going to work. But because of the vulnerability and the medical fragility of some of those residents, it is a concern. And we do anticipate there may be more positives. We don't have a way to quantify that at this time.
Doctor, you said only high-risk residents at this facility were going to be tested, about 140. Has that number changed? And what do you qualify as high risk when you're dealing with these individuals? And an important question, will the families be notified if they have been tested? Because some families are frustrated, they're not getting any answers.
So the State Supported Living Center, they have the guardianship or the partnership for guardianship of these residents. And so I think that question should be directed to that agency. I'm unaware of the communication and how they do that with those residents or the families. Tell me the other two parts of your question. You had three parts.
What qualifies as a high risk?
Okay, so high risk. What qualifies as high risk, that is a stratification that we did in partnership with the Living Center. So we tried to find those most at risk because of respiratory chronic infections or the medical fragility that they identified. So we had them stratify that, and our team worked to coordinate that stratification with them. So they gave us those numbers. We tested those. We've gone up one more tier today. I don't know how many people we have tested. My staff was just returning prior to the press conference, but we're testing an additional tier, maybe less risk, moving up one. Again, that's a compromise of how many people are residents there, and we're trying to assess exposure and risk with limited supplies. And so the limited supplies are limiting that testing, and yet we are testing anyone who is symptomatic. This next tier is above and beyond symptomatic, and so we're hopeful that that has more negatives and fewer positives because they're asymptomatic and they have a lower risk.
Are
And
employees being tested as well? Because I know that wasn't the case.
the employees were part, the highest risk employees were part of a cohort of testing today. And so I think, again, my staff was returning, I don't have those numbers, but we did include some staff at the highest risk for those staff members who were caring for those residents, the caretakers and caregivers, and then people that were in and out of some of the home residences of those patients and residents.
For the staff member, is it confirmed that it's community spread from a member of the Denton County Supported Living Center? And can you talk to any demographic information about the staff member with COVID?
So I don't have the demographic information in front of me on a staff member. I will say that the community spread is very much how we believe it got to the Living Center. That's not a surprise. They're a fairly isolated situation in their environment. And so We don't believe that it started there. We do believe the community brought it in. They have 1,400 odd staff members, and so that makes sense that these people live in communities all across the Metroplex. So we know that happened, but it's going to be impossible to trace back because that's not an index case. That's not the first case in Denton County. And so that's what community spread means, is whenever you cannot do the contact tracing and come and pinpoint the initial introduction of the infection into that facility. And by the way, that's a really important point, because that's why we are doing these social distancing and physical distancing mitigation strategies. The reason that's so important is we're not going to be able to contact trace our way back to these index cases. So all assisted living centers, all apartment complexes that are shared with vulnerable populations, these all have a heightened risk. And so collectively, we've got to work together to minimize that. And we see examples when community spread does happen. We're seeing it all across the nation. And this is just, unfortunately, it's a local example.
There are 39 people at this facility who've tested positive. Out of those 39, how many are hospitalized, and how many are hospitalized just in general out of that 137?
Okay, so hospitalizations, the numbers of individuals that have required hospitalization are 29. We're not tracking that daily. I don't know that I have that information in front of me, because people are being admitted and then released. And so that is a moving target every day. I think it's important to show how many required hospitalization. Of the new patients today, my understanding is no additional individuals have been hospitalized, but again, that's a moving target because those individuals could have been transported at some point. I think the community plan has been not to transport those individuals if they weren't an acute situation, because that was the request of the community and the healthcare system in general. But that is always going to be a moment by moment situation.
So 29 to 39 out of the supported living center required hospitalization?
No, 29 total community members in Denton County out of the 137.
Okay, just making sure I'm getting my apple.
Yeah.
That chart is going to be helpful to you, I think.
And how many residents are there out there?
You'll have to ask the SSLC specifically, but I think it's around 440. But again, I think that number changes, if not daily, weekly. So,
Judge, what is it going to take, sir, in your estimation, to increase the measures, to be even more strict, to try and diminish the spread of COVID-19? Are we set for a good amount of time?
So the question is, what other stricter measures would we take to prevent the spread here? I don't think at this time we need to apply any additional measures on the general population or our business community. I think they're bearing a lot of burden right now. What I think we need to have from the public is a compliance with what we're currently doing. The people are complying with the current restrictions on activity and mobility. And also when they go out, like I said earlier, if they go out into the public to do their essential daily functions, if they would comply with social distancing even when they're out at the grocery store, that alone would help solve the problem without having additional measures at this time. So that's what we're really asking for. We are asking for the people of Denton County to share our viewpoint and to share and be partners with us and take individual responsibility. Government cannot solve all the problems. This is going to require individual responsibility for you as an individual and you as a household to help provide social distancing. And so I do know that there are many people who are out there working and they are interacting with the public. And I want to take a moment to salute you and say we appreciate you and what you're actively doing out, because you are essential employees. And I encourage our Denton County citizens to show your appreciation to those people when you're going through that checkout line or when you're at the post office or you're doing other essential functions. Applaud those people, show that you care for them. It is important. They are stressful. They are interacting with the public on a daily basis and they are putting themselves at risk too. So let's all be mindful of them and show appreciation as well. Yes, ma'am.
Do we have a total, we don't have it yet, a total number of how many have been tested out of the supported living center?
I don't have that
The total number?
Do we know what
Go ahead. Restate the question.
as of the last time we did?
So, could you ask me?
And I know what is the current number that you know of that have been tested out there?
I know that.
Unless it might be
Right.
Sure. My staff were coming back. There were well over 100 individuals tested today. There were somewhere on the order of 143 tested on Wednesday. So there have been several hundred tested, but I don't have the specific numbers in front of me.
probably around 250 at least.
I think that is a safe estimate, but again, I don't want to guess. So I just want to say there are many people that have been tested, and we don't want to quote a number that may or may not be accurate. But there have been many people tested, both residents and staff.
Thank you. Good questions. Other questions?
On the enforcement component, I was curious if you could speak to this essential versus non-essential. I think there's been a lot of confusion in the community about what businesses can and can't operate. Like, on my drive here, I saw some vape shops open. I was wondering if you could speak to how you're clarifying with the community what's essential versus non-essential, and how you're enforcing that if non-essential businesses are operating right now.
So the question is, how did we pick essential and non-essential? So we looked at a variety of federal documents that helped outline that as far as what are essential and non-essential employees. Then we also looked at what was also being done regionally here. We do believe that there are regional partners here, our other counties. We looked at those. Then we did make some modifications to that we believe best fit our circumstances up here in Denton County. We have communicated with our mayors and our city managers across the county that we are looking for at this first phase for people. We want everyone to comply, but we are really looking for education because there is some confusion. We have been had a large volume of people calling our office, calling other county buildings. We have tried to communicate that not only in our orders, which have been posted online when we took the action. We've also shared additional documents to provide extra and further explanation of the closures. And so we've worked with our chambers of commerce and others, and we will continue to do so. The part of the thing that we're looking at, again, is education. We believe education is the first phase, although we do want compliance from the very beginning. We will look and seek enforcement. We have talked to our mayors about the enforcement measures, and there have been some violators, and I would think that I would give credit to some of those people and grace to some of those people because I think they were based on confusion versus defiance. And so, but the cities have been partnering with the county to seek compliance across the board.
So did you extend the stay-at-home, sir? The stay-at-home program?
Yes, the stay-at-home was extended through midnight on March 31st as of now. And that, again, that will be reviewed. That was based on the actions of the Commissioners Court this morning, but that will be reviewed again next Tuesday morning and may be extended.
The state says that they're in contact, I know you're not the state, but that they're in contact with hospitals that would take patients that would need hospitalization if that is the case, so as to not overwhelm a single hospital in your county. Do you know what hospitals are helping essentially the state with this?
I don't. It's a variety of hospitals in multiple different networks across DFW Airport. And so the DFW Metropolitan County judges have been in close communication with our DFW Hospital Council as we've been talking about strategic plans and as they are prepared to ramp up for the influx of just the general population. And so I do believe that our hospitals are well prepared with plans. There are they have the planning. I do believe that there's resources and supplies, which we've always talked about with PPE shortages, testing shortages, and we're worried about staffing shortages as well. If the healthcare providers become infected, that could provide additional complications to the region.
Do you know if PPEs were already handed out today to staff members of this facility?
I can't. I'll let the doctor speak to that. I will say that not only has there's been collaboration amongst the county judges in the area and our hospital CEOs, but in our state delegation we talked about today, but Congressman Burgess has been active to help. He's been very helpful, as has Congressman Kenny Marchant, working on finding financing and mechanisms to help keep some of these facilities open and staffed up. So I want to give credit to our good congressman as well. Did you want to address the PPE?
We did send recommendations to the facility on the use of PPE, and I know that our staff, we've been working with them on the guidelines on how best to utilize PPE in a shortage. My understanding is that the Living Center is currently using PPE, but as far as the numbers or any of the specifics, you'd have to work with them.
Yes, Judge, what is your message, sir, to people who have their loved ones at this facility who are, I mean, they're seeing these numbers, it's only growing, unfortunately, and they're scared, and they can't have contact with their family member, and maybe their family member can't speak for themselves right now. What is your message?
So the question is, what is the message that we would have for the family members the families who have loved ones out at the state supported living center? Our message is that we share your concern. And because we share your concern, we have been working in a strategic manner to get all the resources that we can. These are valuable members of our society. We care for them, and they are in good hands, and that the governor on down of the state of Texas has them on their mind. Our state legislators, our governor, the county officials, the city officials, the staff of the city, the fire department, the police department, and the hospitals, they are on top of our mind. And this last couple of weeks, we've been working to provide a clear plan of action to keep them safe. Any further questions? I want to thank y'all for coming up today. Thank you.